5 early warning signs of lupus. Most doctors. Miss Hello, everyone. I'm Dr. Micah Yu, an integrative rheumatologist with years of experience helping patients navigate the complexities of autoimmune diseases. Today, I want to share critical information about lupus, a serious condition that can affect any organ in your body, from your brain to your kidneys, lungs, and beyond. Lupus is one of the biggest mimickers in medicine, often disguising itself as other diseases, which makes it challenging to diagnose. Unfortunately, many doctors aren't adequately trained to spot its subtle signs, and this can lead to missed or delayed diagnoses, sometimes with devastating consequences. If you don't educate yourself about lupus, you might overlook its early warning signs, allowing the disease to progress unchecked. I've seen patients in my clinic who've gone from doctor to doctor, only to be told their symptoms are all in their head or sent to the wrong specialist. This is heartbreaking because lupus is treatable, especially when caught early. In my practice, I've encountered patients with early lupus symptoms who were fortunate to get a timely diagnosis, but I've also seen those with advanced disease, undiagnosed until they landed in the hospital, or, worse, the ICU. I've had to break the news to patients that their end-stage kidney disease or even a coma was caused by lupus they didn't know they had. These are tragic outcomes that could have been prevented with early detection. My goal today is to empower you with knowledge so you can advocate for yourself or your loved ones. By catching lupus early, you can prevent irreversible damage to vital organs like the kidneys, lungs, or brain. So, let's dive into the 5 early warning signs of lupus that you and your doctors should never miss, along with 2 bonus signs that are often overlooked. 5 early warning signs of lupus. 5 early warning signs of lupus. 1. Achy joints that won't quit. The first early warning sign of lupus is persistent joint pain and stiffness, often accompanied by swelling. If you are waking up with stiff joints that take 30 minutes or more to loosen up, or if your joints are swollen and feel better with movement, you need to consider lupus as a possibility. Now, joint pain and stiffness can also occur in other conditions like menopause, rheumatoid arthritis, or osteoarthritis, which is wear and tear arthritis. But the pattern of lupus-related joint pain is distinct. Morning stiffness that improves as you move is a red flag. Don't dismiss these symptoms, even if they seem mild. While lupus might not be the cause, keeping it in the back of your mind is crucial because missing it could lead to bigger problems down the road. To confirm whether lupus is the culprit, your doctor should order specific blood tests, such as an ANA, anti-nuclear antibody test, to look for autoimmune activity. If you're experiencing these symptoms, talk to your doctor about ruling out lupus with the right labs. 2. Rash that flares in the sun. The second warning sign is sun sensitivity and skin rashes. Let's break this down into 2 parts: photosensitivity and rashes. People with lupus often have extreme sensitivity to sunlight, where their skin turns red after just a few minutes of sun exposure, sometimes as little as 5 or 10 minutes. This is called photosensitivity, and it's a hallmark of lupus. As for skin rashes, lupus can cause a variety of them. The most well-known is the malar rash, also called the butterfly rash, which appears as a red or flushed area across the cheeks and nose, with or without sun exposure. You might also notice red, itchy blotches on your legs, arms, back, or other areas of your body. In some cases, lupus causes discoid lupus, which leads to scarring rashes. A famous example is the musician Seal, who has visible facial scarring from discoid lupus. These rashes can be more than just a cosmetic issue. They might be the first clue that lupus is active in your body. If you have a persistent rash that doesn't go away, don't wait. See a dermatologist. They can evaluate whether it's related to lupus, especially since untreated skin lupus can signal more systemic issues to come. Early intervention is key to preventing further complications. 3. Fevers with no clear reason. The third warning sign is recurrent fevers without an obvious cause. If you're experiencing fevers and your doctor has ruled out infections, cancer, or other common causes, it's time to consider autoimmune diseases like lupus. In medical terms, this is called a fever of unknown origin, FUO. When doctors encounter FUO, we think of three main possibilities: infections, autoimmune diseases, and cancer. As a rheumatologist, I focus on autoimmune causes, and lupus is a key player here. Fevers caused by lupus alone are rare, but they can occur, especially alongside other lupus symptoms. To confirm whether lupus is behind your fevers, your doctor should order blood tests, including the ANA test, double-strand DNA, and complement levels, C3 and C4, which measure inflammation and immune activity. These tests can help pinpoint whether lupus is driving your symptoms. If you're dealing with unexplained fevers, don't let them go unchecked. Push for answers. 4. Hair falling out, suddenly. The fourth early warning sign is hair loss, medically known as alopecia. Lupus can cause hair to fall out in different ways. You might notice diffuse hair loss, where your hair thins all over your scalp, or you might lose hair in patches or chunks. In some cases, the hair loss is scarring, meaning the hair won't grow back in those areas. This can be distressing, and it's a sign you shouldn't ignore. If your primary care doctor can't figure out why your hair is falling out, it's time to see a dermatologist. They may recommend a scalp biopsy to determine the cause, and you might also need to consult a rheumatologist. Blood tests can help confirm if lupus is driving the hair loss. Don't assume it's just stress or aging. Lupus could be the underlying issue, and catching it early can make a big difference. 5. Tired, no matter what you do. The fifth warning sign is persistent fatigue that doesn't improve no matter how much you rest. Lupus causes systemic inflammation, which can leave you feeling exhausted even if you're not physically overexerting yourself. Fatigue is a tricky symptom because it's common in many conditions, from hormonal imbalances to infections to stress. But when fatigue is paired with other signs like joint pain or rashes, it could be an early clue of lupus. If you're constantly tired, don't let your doctor brush it off. Ask them to rule out other causes like thyroid issues, infections, cancer, or other autoimmune diseases. Blood tests for lupus, such as the ANA and complement levels, can help determine if it's related to an autoimmune process. Also, take a look at your lifestyle. Chronic stress or overwork can contribute to fatigue, but lupus could be the hidden driver. Advocate for a thorough workup to get to the root cause.